Hey guys, my name is Nora. I'm a naturopathic doctor here in Vancouver, and today I wanted to talk about a condition that I see pretty frequently in my clinic called PCOS or polycystic ovarian syndrome, and I want to give you the top 3 things that you can do to get a head start on treating this condition naturally. So one thing to keep in mind about PCOS is that this is a condition of excess androgen activity. And what this means is that there's basically a lot of activity of the male hormones in the body. Now, both women and men have both female and male hormones in different amounts, obviously. However, in PCOS, there's a little bit more of that male hormone activity going on driving this condition. And there's also usually some level of insulin insensitivity or insulin resistance and blood sugar imbalance, even though it may look normal on labs. This is another driving factor of this condition. So keeping that in mind, the first thing that you can do for yourself to get a head start on treating this condition naturally would be to change your diet from whatever it is now to something more along the lines of a paleo diet. This is usually the best type of diet to be on for PCOS because it is very low in carbs, very low in sugar, and high in proteins and good fats. And you want to obviously source those proteins from good sources. So you want to have grass-fed meat, organic chicken, wild fish, that kind of thing. But sticking to sort of a paleo, low carb, low sugar diet will really, really help make a huge difference with regards to regulating that blood sugar, which is going to, in the long run, help to regulate your hormones. The second thing that you can do is to actually drink spearmint tea. Now, this seems like a simple enough suggestion, but there's been a lot of research lately suggesting that spearmint tea actually helps to bring down that androgen activity that I was talking about earlier. So it's something very easy that you can do every day, and in the long run, it can actually help with the regulation of the hormones, help bring down that androgen activity, and help balance your own female hormones. The last and final thing, the third thing that you can do is to either lose weight, come down to a healthy weight if you are overweight, or increase your exercise. And this is something that on its own, even if you don't do the diet, you don't do anything else, will help you regulate your cycles if they are irregular, since this is a common symptom of this condition. So doing that alone can have a tremendous impact on the condition. So definitely bringing up exercise, concentrating on weight-bearing exercise versus cardio. Now, a lot of the time there are issues with weight loss in PCOS, and that can be due to a number of different reasons, usually hormonal imbalance that kind of causes women to plateau and not lose weight effectively. And there are many things that we can do from a naturopathic standpoint to help get that going. Now, lastly, I would just add that I always recommend seeing a naturopathic doctor to manage PCOS, whether or not you're going to manage it through Western medicine or not. The two sort of main types of women that we see are women with PCOS who are trying to conceive, and then women with PCOS who are not trying to conceive but just want to regulate their cycles and obviously get rid of the symptoms that are associated with PCOS. Now, the main treatment for women who are not trying to conceive and have PCOS is birth control. And we know that this doesn't give you really a true cycle. It does cause you to have a period. However, this is a fake bleed while you are on the pill, and it's not reflective of what's actually going on in your body. And I would recommend still having an alternative healthcare practitioner support your body even while being on the pill, so that when you are ready to come off of it, you make that transition a lot easier for yourself. And then the second scenario where a woman is trying to conceive, we see a lot of women who are trying to conceive with PCOS, and not all of them want to do IVF or have the resources to do so, since it is very expensive. So it's really nice for us to be able to offer alternative treatments that will help them regulate this condition and get it under control and even conceive and have a healthy baby. The only treatment really in Western medicine is drugs like clomiphene or letrozole that they will use either during an IUI, or you can also try IVF as well. So there are many ways that we can support women who have PCOS naturally, and it's really about addressing the root cause. Everybody's different, and everybody with PCOS presents differently, and our job is to see what every different patient needs. And so that's my 2 cents on this condition. There's a lot more to it than what I've said, but I just wanted to provide you with a little bit of information to start with. If you have any questions, I'm going to leave my email and all my clinic information down below, and I would be happy to chat with you. And that's it. I hope you have a wonderful day, and thank you for watching my video. Take care.